Every October, Medicare sends you an annual notice of change. Most retirees glance at it and throw it away. That single decision, ignoring that notice, can cost $500 to $2,000 per year in unnecessary healthcare premiums and drug costs. Medicare open enrollment runs from October 15th to December 7th every year. It is the one window where you can change plans without penalty. Most people never use it. Today is the final video in our 8-week retirement series, and I am ending with Medicare open enrollment because it is the one annual financial action that most retirees can take immediately to put more money back in their pocket, often $1,000 or more per year, with no change to their doctors and no disruption to their care. By the end of this video, you will understand the difference between Original Medicare and Medicare Advantage, how to use medicare.gov to compare plans in 15 minutes, the 5 mistakes most retirees make when choosing plans, and the exact steps to make a change during open enrollment. First, the fundamental choice every Medicare enrollee makes: Original Medicare versus Medicare Advantage. Understanding this choice is the foundation of all Medicare planning. Original Medicare, Parts A and B, is the traditional government program. Part A covers hospital care. Part B covers doctor visits, outpatient services, and preventative care. Original Medicare is accepted by almost every doctor and hospital in the country. You pay the standard Part B premium, approximately $185 per month in 2026, plus 20% of most covered costs with no annual out-of-pocket maximum. Medicare Advantage Part C is private insurance that replaces Original Medicare. Insurance companies receive payment from Medicare to cover your care. Most Advantage plans have $0 or low monthly premiums, but include copays, deductibles, and an annual out-of-pocket maximum. They typically include prescription drug coverage and often add vision, dental, and hearing benefits. The key trade-off: Original Medicare gives you freedom. Any doctor, any hospital, no network restrictions, but exposes you to unlimited cost sharing without a Medigap supplement. Medicare Advantage gives you cost certainty through the annual out-of-pocket maximum, but restricts you to a network of providers and requires referrals for specialists in many plans for most plans. Who typically does better with Original Medicare plus a Medigap supplement? People with complex health conditions who need access to specialists at any institution. People who travel frequently between states and need nationwide coverage. And people who are willing to pay higher, predictable premiums for freedom and simplicity. Who typically does better with Medicare Advantage? People in good health who primarily use in-network local providers. People who want $0 premiums and value the extra benefits like dental and vision. And people who prefer the simplicity of a single card that covers most services. Part D, prescription drug coverage. If you are on Original Medicare, you must buy a separate Part D plan for prescription coverage or face a late enrollment penalty if you go without creditable drug coverage for more than 63 days. Medicare Advantage plans typically include drug coverage built in. The Part D changes in 2025 and 2026 from the Inflation Reduction Act. The maximum out-of-pocket for covered drugs is now capped at $2,000 per year, a significant change from prior years when there was no cap at all. This makes Part D substantially more valuable for people on expensive medications. The $2,000 cap applies to all Part D plans. How to evaluate your Part D plan each year? The key is not which plan has the lowest premium. The key is which plan covers your specific medications at the lowest total cost, premium plus copays for your drugs. A plan with a $0 premium may cost you $2,000 more per year in drug copays than a plan with a $35 premium that covers your medications well. How to compare plans on medicare.gov in 15 minutes. This is the most important practical skill in Medicare management, and almost nobody does it. The medicare.gov Plan Finder is free, updated annually, and will show you the lowest total cost plan for your specific medications in your specific zip code. Step 1. Go to medicare.gov and click on the blue Find Plans button. You will be asked for your zip code and your Medicare ID number from your Medicare card. Have both ready. Step 2. Enter all your current medications, drug name, dosage, and how many days per prescription. Take your time with this step. The more accurate your medication list, the more accurate the cost comparison. If you are not sure about dosages, use your pharmacy printout or your prescription bottles. Step 3. Enter your preferred pharmacy. The tool will calculate costs based on your specific pharmacy. Mail-order pharmacies often reduce drug costs significantly. Enter both your local pharmacy and a mail-order option to compare. Step 4. Review the results sorted by estimated annual drug plus premium cost. This is your total cost number, the number that actually matters. Look at the top 3 to 5 plans sorted by lowest total cost. Note the star rating. 4 stars or above indicates good quality based on member satisfaction and plan performance. Step 5. If a lower cost plan appears, confirm your doctors are in-network if it is a Medicare Advantage plan. For Part D plans, confirm your pharmacy is in their network at preferred pricing. If the plan checks out, switch. The savings are automatic starting January 1st. The 5 mistakes most retirees make during Medicare open enrollment. Knowing these prevents the most common and costly errors. Mistake 1. Not comparing plans every year. Plans change annually. Your premium changes. Your drug formulary changes, meaning drugs that were covered may now be in a different tier or removed entirely. What was the best plan for you in 2023 may cost you $1,500 more in 2026 for the exact same medications. Compare every October, without exception. Mistake 2. Choosing the plan with the lowest premium. This is the most common mistake. A plan with a $0 premium may have drug copays that cost you $2,000 more per year than a plan with a $35 monthly premium. Always compare total annual cost, premium times 12, plus estimated drug and copay costs, not just the monthly premium. Mistake 3. Not checking whether your doctors are in-network before switching Medicare Advantage plans. Switching to a plan that does not include your primary care doctor or a specialist you see regularly is a serious disruption. Always verify network status before switching. Call the doctor's office directly. Do not rely solely on the online directory, which can be outdated. Mistake 4. Missing the December 7th deadline. Open enrollment closes at midnight on December 7th. Changes do not take effect until January 1st. If you miss the deadline, you are locked into your current plan for the entire following year. Set a phone reminder on October 15th and another on December 1st. Do not let the deadline sneak past you. Mistake 5. Not checking extra help eligibility. If your income and assets are modest, you may qualify for extra help, also called the Low Income Subsidy, which dramatically reduces your Part D premiums, copays, and deductibles. In 2026, individuals with income below approximately $22,590 may qualify. Many people who qualify never apply. For people on Original Medicare, Medigap supplement plans fill the gaps that Original Medicare leaves, primarily the 20% coinsurance and the missing out-of-pocket maximum. Without a supplement, one serious illness can cost tens of thousands of dollars in cost sharing. The most popular options are Plan G and Plan N. Plan G covers nearly everything Original Medicare does not pay: the Part A deductible, the 20% coinsurance for Part B services, and hospital costs. You pay only your Part B premium and the Plan G premium. No copays, no additional billing surprises. Plan G has become the most popular Medigap plan for new enrollees who want simplicity and comprehensive coverage. Plan N covers the 20% coinsurance, but requires small copays for doctor visits, typically $20, and up to $50 for emergency room visits that do not result in admission. Plan N premiums are lower than Plan G, making it attractive for people in good health who see doctors less frequently. Case study. Barbara, 71 years old. She is enrolled in a Medicare Advantage plan with a $0 premium. She takes 3 prescription medications. She has never compared her plan since she enrolled at 65. In 2025, her annual out-of-pocket drug cost under her current plan, $2,100. She considers this normal and has no idea a better option may exist. Barbara uses the medicare.gov Plan Finder in October. She enters her 3 medications and her pharmacy. The tool shows that a different Medicare Advantage plan in her area covers all 3 medications at a lower tier, reducing her annual drug cost from $2,100 to $680. The new plan also has a $0 premium. Her total annual savings, $1,420. Barbara checks that her primary care doctor and her cardiologist are both in the new plan's network. They are. She switches during open enrollment. Starting January 1st, she pays $1,420 less per year for identical care with the same doctors. The annual 15-minute plan comparison will save her approximately $28,000 over 20 years of retirement. Barbara's lesson: the best Medicare plan for you at 65 is rarely the best plan at 71. Drug formularies change, your medications change, plan networks change, premiums change. The 15 minutes you invest every October in comparing plans is the highest return investment of time in all of retirement planning. Your Medicare Open Enrollment Action Checklist. 5 actions to complete every October between October 15th and December 7th. Action 1. Set 2 calendar reminders right now. October 15th, open enrollment begins. Run your comparison. December 1st, deadline reminder. Confirm your switch is complete or decision is made. These 2 reminders are worth thousands of dollars in potential savings. Action 2. Gather your current medication list with dosages before October 15th. Call your pharmacy or log into your pharmacy app to confirm each medication, dosage, and day's supply. This list is the most important input to the plan comparison tool. Action 3. Go to medicare.gov between October 15th and December 7th. Use the Plan Finder. Enter your medications, your pharmacy, and your zip code. Sort by estimated annual drug plus premium cost. Review the top 3 plans by total cost and star rating. Action 4. If switching Medicare Advantage plans, call your most important doctors and specialists to confirm they are in network with the new plan. Do not rely on the online directory. One phone call to each key provider takes 5 minutes and prevents a year of disruption. Action 5. Check extra help eligibility at ssa.gov if your income is modest. If you have significant medical costs and your income is below approximately $22,590 for a single person or $30,660 for a married couple, you may qualify for significant help with Part D premiums and drug copays. This is the final video in our 8-week Calm Money Retirement series. Over 8 weeks, we have covered Social Security timing, spousal and survivor benefits, Social Security taxes, the 3-bucket withdrawal strategy, retirement planning mistakes, Roth conversions, retirement age milestones, the HSA as a retirement account, the first 30 days after retiring, RMDs, 10 things nobody tells you about year 1, annuities, safe withdrawal rates, Secure 2.0, and now Medicare Open Enrollment. Every video in this series was designed to give you one thing: the framework to make the financial decisions in retirement with clarity rather than fear. You now have that framework. The decisions ahead of you are not easy, but they are navigable, and you are better equipped than most people who enter retirement will ever be. If this series helped you, please share it with one person approaching retirement who you care about. Every video in the playlist is free. No products to sell, no agenda except helping people retire with the information they deserve. Share the playlist. Pass it forward. Subscribe to Calm Money Retirement. We will continue publishing every Tuesday and Friday, one retirement topic at a time, explained slowly, clearly, and without pressure. Thank you for being here. Take care of yourself. Disclaimer: this video is for educational purposes only and does not constitute personalized financial, Medicare, or insurance advice. Medicare plan options, premiums, formularies, and eligibility rules change annually. Always verify your plan options at medicare.gov or by calling 1-800-MEDICARE. For personalized guidance, consult a licensed Medicare insurance specialist or fee-only financial advisor. Calm Money Retirement is not a registered investment advisor.